Hello everyone. In this session, let's learn about the chief artery supplying the upper limb, the axillary artery. So in this session, we are going to learn the axillary artery, its course, relations, paths and branches. So, what is this axillary artery and where is it coming from? Okay, so here consider this to be the first strip. So, at the outer border of the first strip, we have the axillary artery that is beginning as the continuation of subclavian artery. So, axillary artery is nothing but the continuation of the subclavian artery at the outer border of first strip. Okay, and its termination. It terminates as the brachial artery at the lower border of this muscle called teres major. So, there is a crucial muscle that is dividing the axillary artery into three major parts. That is the pectoralis minor muscle. Okay, so this pectoralis minor muscle will divide the axillary artery into three parts. So, that part of artery that is superior to the muscle is the first part, and that is deep to the muscle is the second part, and third part is inferior to the pectoralis minor muscle. Okay, so axillary artery is basically divided into three parts by pectoralis minor muscle. Now, what is its course in the axilla? Okay, so to learn its course in the axilla, just imagine the four walls of the anterior wall of the axilla, posterior wall, medial wall, and the lateral wall. So, along its entire course in the axilla, this axillary artery runs across or along the lateral wall of the axilla. It is being more nearer to its anterior wall than the posterior wall. That is, it is being more nearer to the muscles pectoralis major and pectoralis minor. Those are forming the anterior wall of the axilla. And axillary vein always being medial to the artery, and the cords of brachial plexus forming its relations mainly to the second part of the artery. Now let's study the relations of the axillary artery separately for each part. So let's represent it in the cross section. The first part, second part and the third part. A common relation for all of them is axillary vein being medial to the artery. And for writing the relations, you have to imagine the previous diagram of the boundaries of axilla. The anterior boundary is by pectoralis major and pectoralis minor muscles. So you have pectoralis major forming the anterior boundary for the first part of axillary artery, whereas you have pectoralis minor from the second part. Okay, so pectoralis minor forms the anterior relation for the second part of the axillary artery. Whereas coming to the posterior relations, as you can see in the boundaries and contents of axilla, it is the subscapularis muscle. Okay, so the subscapularis muscle forms the posterior relation for the second part and the third part, whereas serratus anterior muscle forms the posterior relation in the first part. Okay, now in the third part, we have one more muscle called the teres major muscle. So teres major also forms the posterior relation for the third part of the axillary artery. Okay. Now coming to the cords of brachial plexus and their arrangement. For the second part, it's quite simple that lateral cord forms the lateral relation, medial cord forms the medial relation, and posterior cord forms the posterior relation of the artery. Whereas coming to the first part of the artery, so we have the lateral cord, medial cord, posterior cord arranged this way, and a long thoracic nerve. So anteriorly, as we have discussed, we have this pectoralis major muscle. Along with this, we have a nerve loop here. What is this nerve loop? It is a loop of communication between the lateral and the medial pectoral nerves. So the lateral and medial pectoral nerves communicate by a loop. So that is forming the anterior relation for the axillary artery. In the posterior, we have the medial cord and long thoracic nerve. And laterally, we have the lateral and posterior cords of the brachial plexus. Now the second part. Second part, easy to summarize. Anteriorly, pectoralis major and minor. Posteriorly, subscapularis. Laterally, lateral cord. Medially, medial cord along with the axillary vein. And posteriorly, the posterior cord. Now, coming to the third part of axillary artery. In the third part of the axillary artery, anteriorly, we have no muscle that is covering anteriorly, okay. We have the medial root of the median nerve, okay. The medial root of median nerve forms the anterior relation of the third part of axillary artery. Coming to the posterior relations, okay. Posteriorly we have subscapularis and teres major, okay, whereas the nerves which are present here are radial nerve and axillary nerve. Radial nerve and axillary nerve being the branches of lateral cord of the brachial plexus. They form the posterior relation of third part of axillary artery. And medially, as we know, we have the medial axillary vein. Along with that, we have the medial cutaneous nerve of the forearm and the ulnar nerve, okay. And laterally, we have a single nerve, that is the musculocutaneous nerve. These are the relations of the third part of axillary artery. Now let's look at the branches of axillary artery. The first part has one branch, second part gives two branches, and third part gives three branches. So from the first part, we have a small branch that is arising at the subclavius, that is superior thoracic artery. The superior thoracic artery is running between pectoralis major and pectoralis minor muscles, and it supplies the medial wall of the axilla. From the second part, we have the long thoracic artery and the thoracoacromial artery. This thoracoacromial artery is unique because it is piercing the clavipectoral fascia and gives off four branches again. One is the pectoral branch, other one is the clavicular branch, deltoid branch, and acromial branch. The pectoral branch is going to supply the pectoral muscles. The clavicular branch is going to supply the sternoclavicular joint and subclavius muscles. The deltoid branch runs in the deltopectoral groove, and acromial branch is ending by joining the anastomosis over the acromion process. Now coming to the long thoracic artery. This long thoracic artery is emerging at the inferior border of the pectoralis minor muscle, and it supplies the pectoralis major, minor, and serratus anterior muscles. Now, this lateral thoracic artery is large and provides important supply to the breast in case of females. Now, third part is having three branches. The third part branches include the largest branch of the axillary artery, that is the subscapular artery. Subscapular artery runs along the lower border of the subscapularis muscle, and it ends at the inferior border or inferior angle of the scapula. Another large branch, the circumflex scapular artery from the subscapular artery. So this circumflex scapular artery, it runs in the upper triangular space, and then it winds around the lateral border of the scapula, and it enters the infraspinous fossa. So it enters the upper triangular space, winds around lateral border of scapula, and then enters the infraspinous fossa. The other branches of the third part include the anterior and posterior circumflex humeral arteries. The anterior circumflex humeral artery, it is a small branch. This passes in front of the surgical neck of humerus, and it is anastomosing with the posterior circumflex humeral artery. The posterior circumflex humeral artery is larger than the anterior circumflex artery. So this anterior circumflex humeral artery, it gives again an ascending branch that runs in the intertubercular sulcus of the humerus. So it is supplying the head of the humerus and the shoulder joint. So this anterior circumflex humerus artery, it passes in front of the surgical neck, enters the intertubercular sulcus, and supplies the head of the humerus and shoulder joint. It is having an other ascending branch. The posterior circumflex humeral artery, being a larger branch than the anterior circumflex humeral artery, it passes backward along with the axillary nerve through the quadrangular space. So this runs in the quadrangular space and it crosses the posterior aspect of surgical neck of humerus. So anterior aspect is crossed by this anterior circumflex artery and posterior aspect is crossed by the posterior circumflex artery, that is the surgical neck of humerus. So it passes across the posterior aspect of surgical neck of humerus and it is anastomosing with the anterior circumflex artery and it is supplying the deltoid muscle and shoulder joint. So both of the circumflex arteries will supply the shoulder joint, and we have the circumflex scapular artery runs in the upper triangular space. Posterior circumflex humeral artery runs in the quadrangular space. So this is the axillary artery, its course, relations and branches. Coming to its clinical aspects, this axillary artery pulsations can be known because it can be felt at the lateral wall of the axilla. In the lateral wall of the axilla, we can compress it against the lateral wall of the axilla in its lower part. So in its lower part, we can compress it against the lateral wall of the axilla so that we can control the bleeding of the upper limb. That is the distal part of the upper limb. Bleeding can be controlled on its compression and pulsations of artery can be felt. Hope this helps. Thank you.